الله لا إله إلا هو له الأسماء الحسنى.
Inshallah ta'ala, Dr. Amir will be explaining some health points, inshallah ta'ala. Today is his speech. I read an ayat from Quran Kareem, two ayats in fact. First one is saying that Allah subhanahu wa ta'ala has made fasting compulsory on you. And the reason why is لَعَلَّكُمْ تَتَّقُونَ, so you can be pious. Piety, being pious, and be able to fast, that can only be done when we are healthy enough. If we are not healthy, we are ill, we have health issue, we won't be able to fast, either not fast or either not fast at all, or fast but with hardship. Shariat Mutahara doesn't want us to do that. Shariat Mutahara wants us to fast and fast with health. And so some of the benefits and the hikmat and wisdom of fasting is that our health gets better. And the only way it will get better if we fast according to our body, what our body says to us. That's the main thing. So for that, sometime we will need some medication. So if we are on any kind of medication, Rasulullah sallallahu alaihi wasallam says it's sunnah to take medication. So Rasulullah sallallahu alaihi wasallam has advised us that whenever we are ill, we take our medication. If we say I'm mutawakkil, I rely on Allah subhanahu wa ta'ala, that's not relying. This is committing suicide. What Allah subhanahu wa ta'ala says, وَلَا تَقْتُلُوا أَنفُسَكُمْ, do not commit suicide. So one thing is taking your whole life, and number two is taking some of the organs. You know, sometimes if we are not taking our medication on time or not taking properly as we are advised, it can lead us to have medical issues. And because of that, we can sometimes lose an organ. And if we do that basically on purpose, intentionally, we will get sinful for it. And Rasulullah sallallahu alaihi wasallam said to the Sahaba that do everything according to what your body is indicating. Basically, Rasulullah sallallahu alaihi wasallam says, "Inna li badanika alayka haqqan," that your body has got rights on you. So give it the right sleep, give it the right food, nourish it properly, and according to what your body says, do that much ibadat what your body can take. This is what the teaching of Rasulullah sallallahu alaihi wasallam is. It's not, some Sahaba said we will stay awake all night, we will fast every day, and we will do this and this. And Rasulullah said, no. If I'm doing something, Allah subhanahu wa ta'ala is the one that is feeding me. I get fed from Allah subhanahu wa ta'ala, meaning I have the power. But you don't have the power. So you go according to your body. What your body language is saying to you, go according to that. So anyway, what I'm trying to say is that the main part of our fasting is our health. If we do not take care of our health, alright, we won't be able to fast properly or not fast at all. So health is it plays a main part in our fasting. Rasulullah sallallahu alaihi wasallam used to fast for the whole Shaban, the whole month of Shaban. But to us, he says, in the last 15 days, stop fasting. Why? So the body builds itself up and nourishes itself up and be ready for the main fasting of Ramadan al-Mubarak. So these are all the teaching of Rasulullah sallallahu alaihi wasallam. So we need to understand the teaching of Rasulullah sallallahu alaihi wasallam, and the core part that plays in our fasting is our health. So health is the main thing. Dr. Sawa speak the rest.
Bismillahirrahmanirrahim. Assalamu alaikum warahmatullahi wabarakatuh. Jazakallah Mufti Saab for inviting me. You must be thinking every year I come and tell you the same talk again and again, but it's just like what Mufti Saab gives you a reminder of what you already know religious, for your spiritual benefits. Same as It's a reminder for your health benefits. Probably you know most of these things, but just before Ramadan, I come in because you can pick one or two things that are related to you. And as Mustab said, that we are, every body is different from another's body. So you may have some medical conditions, you may be a different age group. So every body has got a different mechanisms that adopt to their age, gender, and medical conditions. So I call this fasting and feasting because that's what we do. We fast and then we have a big feast in Ramadan for iftar. And we do it because it connects us to our social friends, socially, family, everybody comes together as a community. So it's important for us to actually have that feasting part as well. But how can we do it more healthily in Ramadan? That's what we are going to discuss. um, as Mufti Sahab said that we need to look after ourselves and have everything in moderation, because we are the moderate ummah in the middle. So our food, our diet should be moderate as well. So, and part of our a good healthy routine is good sleep, good fluid intake, and good diet. Our body needs energy to function. Energy comes from food and drink that we consume. Our daily fluid requirement is about 2 liters, that is 6 to 8 glasses in 24 hours of fluid. That includes tea, coffee, juices, water, whatever we take. And then we need about, depends on how active we are, about 1800 to 3000 calories. So just for understanding, one chapati, a small chapati of this size is about 100 calories. So if you're think about it, there are plenty of scope to, if you are dividing the meals in a normal day, because we eat 3 meals normally, but in Ramadan we'll have 2 meals. So we have to get those calories in 2 meals. So you're aiming for about, say, if, because we're not so active as well in Ramadan, so our calorie requirement is less compared to a normal day. Inshallah, we'll be starting Ramadan in about a week to 10 days time, and 1 week, inshallah. And we'll be fasting for about 12 to 14 hours through the period of Ramadan. And we'll have about 10 to 12 hours of eating and drinking and sleeping time as well. So we need to make sure that we utilize that time effectively and healthily. So that there are numerous benefits of fasting for spiritual reasons, but it has got some benefits for medical reasons. Intermittent fasting, you might have heard, has become kind of recognized way of losing weight and keeping healthy. So a lot of non-Muslims are actually adopting to what we call is intermittent fasting. They fast a couple of days in a week. They don't eat or drink for 8 to 10 hours in a day. So it keeps them healthy, controls the blood sugars and blood pressure. So there is a lot of evidence that fasting helps to lose weight, but it only, you can lose weight if you adopt to a good diet. If you're having a lot of unhealthy diet, you won't lose weight. And most of our people don't lose weight because they're not eating, but they're eating too much at iftar. So, and not eating the right food as well. Mufti Sahib said fasting has been made mandatory to us, but pakoda and samosa is not mandatory. So we want to make sure that we eat healthy. So how do we lose weight? When we eat, the food is converted into glucose, and that provides energy for a few hours, and then we have to eat again. But when you are fasting, your body goes into a state of hunger, and it starts to break down the fat, which is converted into energy inside the body and provides the energy throughout the day. So you're actually, when you're fasting for a longer period of time, then you're breaking down the fat, which is converted into energy to keep your body functions working. So it's a good way to actually lose weight, especially if you have, if you're fasting all day. Towards the end, just before iftar time, if you go for a walk, not heavy exercise, just for a walk, you will start to burn those calories or the fat quicker at that time, and you will have more benefit of fasting and weight loss. It can control your blood pressure, it brings your blood pressure down. It can control your cholesterol level as well, only when you don't eat unhealthy food. I was giving this talk yesterday in one of the other mosques, and they asked me what oils to eat and what drink. So I'll just quickly tell you that any butter, ghee, oil which we use is solid at room temperature is not good for your health. Anything that's liquid is preferable. So like olive oil, rapeseed oil, avocado oil are top oils that you use for food and cooking. If you eat butter, ghee, solid oils, palm oil, they are all unhealthy. Olive oil is good. हाँ, ऑलिव ऑयल अच्छा ऑयल है, उसको आप ड्रिजल करके भी डाले। तो जिस तरह मैंने आपको कैलोरी बताई, तो एक स्पून जो होता है, टेबल स्पून हैज गॉट 100 कैलोरीज। अगर आप सोचे कि हाउ मच वी आर पुटिंग इन आवर फूड, that's too much, isn't it? Yeah. So we need to reduce the amount of oil as well when we are cooking. It's Fasting is good for our mental well-being. When we are fasting religiously, we are aware that we should not speak bad for somebody. We need to control ourselves. So it actually is good for our mental, because you get that self-control because of fasting. And that you can, if you do it for 30 days, then your mind and body adopts to that behavior, and you can actually continue. So it's very important that if you make an intent that I want to control my certain behaviors, like if you are get angry very quickly, try to control it, and hopefully inshallah that behavior will adapt to your body, and it will continue further on as well after Ramadan. So it's good for people who get depressed or anxious. So fasting is a way to actually get closer to Allah, but also it changes the chemicals in your brain and body, which will help to reduce these anxiety and depression symptoms. It's a good opportunity if some of our brothers have got bad habits like smoking, cigarettes, shisha, vaping, they can come off it. Because I know that people who do fast and are smokers as well, they stop smoking during the fasting time because they're going to break the fast otherwise. So they do it at sehri time and iftar time. But if they normally smoke 20 cigarettes a day and that's down to 2, so they've got the willpower to do it, but they do need to understand that's not good for their health, because smoking is a leading cause of lung cancer, heart disease, strokes. So when you're young, you don't get this. When you get older, if you smoked in the past, that will affect you at later age. So when we are young, we don't realize that we are unwell, so we do all these bad habits. But when later on in the life, when it's affect, it's maybe too late. So it's right time is now, and it's also waste of money. So if you need help, that's the number for smoking cessation helpline. You can contact them. You don't need to see a doctor, nurse, or anybody. You can directly contact them, and they will give you help to how to stop smoking and prescribe you stuff that you need to come off the smoking as well. Although fasting, if you do healthily, it will look after your body, but we do come across some problems which is related to our unhealthy eating habits. So for example, a lot of people miss suhoor or sehri. They don't eat sehri because they're sleeping, or they get up late. So you've actually missed an opportunity to feed your body through the day. So it's very important to have your suhoor meal. I think the most important medically the meal when you're fasting is your suhoor meal, because you are going to be functioning during the day, not at night time. So you need that energy which comes from your sehri or suhoor meal to provide you energy through the day. After time, you probably eat a lot, then go for tarawih, then come back home and sleep. So that extra energy that's not utilized is converted into fat again. So it's very important that we eat a good meal in the morning that provides us energy through the day. And I'll go through some quick recipes as well, what to eat. We don't drink enough fluids, 6 to 8 glasses, but you don't have to consume that all in sehri time. If you drink like 4 glasses, we are not camels, we don't have humps, we don't store water. So whatever we body needs in that couple of hours, it will consume, and it will come out of your from your kidneys out, and you will be back and forth to the toilet most of the night, so it will disturb your sleep as well. So don't drink too much in suhoor time. maybe 1 or 2 glasses is enough. And then when at aftar time when you drink, break it down through the time, all through when you're, Taraweeh time, just take a bottle with you and try and drink enough.
If your car is not illegal park, the traffic wardens are walking outside. You don't want to get a ticket. Give the money to the masjid, not to the traffic wardens.
So the other thing is to sleep. Our body needs rest because that's the time our body recovers, and we need about 7 to 8 hours of sleep time, which is not quite possible because how we are waking up through the night. We're going to, so try and go to bed early, just after Taraweeh prayer. When you go home, wake up, and then once you're awake, then you can be awake. So if you have a good 6 hours sleep in between, if you're breaking your sleep, then obviously it's quite difficult. So once you wake up for tahajjud, then have your sehri, do your fajr, then you're awake. Or you can have a nap during the day if you've not had enough sleep. So, in afternoon, after Zohar, have a nap because your body needs that rest to recover. Because fasting itself is a stress process in the body. Your body needs that recovery. As Mufti Saab said, we can't do it all year. That's why it's only a month in a year. One of the most common complaints that we come across is heartburn, indigestion, mede ki kharabi, gas ki taklif. That's what we see in everyday life. So in Ramadan, everything changes. What people have got all year, they come in Ramadan with different complaints, and they are all related to bad habits of eating, poor habits of sleeping, not having enough water. So one of the things is, if you have heartburn, like burning sensation in your chest, and the acid is coming into your throat, or you feel bloated, or tummy is not digest food probably, it's probably because you're eating wrong foods, which are fried, which are spicy. If you're having too much tea, coffee, fizzy drinks, they all of these things will increase the acid in your stomach. So the way to do it is try and avoid those foods, because not everybody can consume those. As you grow older, your food will remain in your stomach longer, produce more acid. So you'll see the elderly people have more problem with this. You can go to a pharmacy or supermarkets to get Rennies, Gaviscon, S-omeprazole, Nexium capsules, or if you're on a lot of medications, then your GP can prescribe you something as well. Headache is another problem, and that occurs because we don't drink enough water and also not having enough sleep. So make sure you drink 6 to 8 glasses of water, and do not miss your suhoor meal, because if you're hungry, there's no energy in body will react, give you a headache. And if you do get a headache regularly, then you can take some paracetamol at sehri time or iftar time, no problem. It will prevent or resolve the headache. You don't want it's not weather is fine at the moment, so we're not normally, if you're in a hot environment, then you can get dehydrated. But 6 to 8 glasses or 2 liters of fluid is important through the 24 hours. And avoid any vigorous exercise. So it's okay to go for a walk, half an hour, 40 minutes walk, no problem. But if you're running, jogging, doing half marathon, or doing gym exercises very strenuous, that's not good for you, because it's going to dehydrate you, cause more problems, and you might not be able to fast the whole month then, because you'll become unwell. Constipation, kabaz, is a very common problem we come across, because we are not having enough fluid, our food is not right, we don't have enough salad, fiber in our diet, and that's what's causing it. So maybe change your diet. If you suffer from constipation already, then take some laxative regularly through the Ramadan, so you don't have that problem. So laxatives are easily available through chemists as well, and supermarkets as well. And if you're on a lot of medication, make sure you speak to your doctor to get the right laxative. But taking some Vitabex type of a cereal will help, because it's going to give you fiber, and having some fruits in the evening, maybe in iftar time, probably provide some fiber as well. Salads and vegetables have got fiber. So healthy diet contains portion, 1/3 of your plate should be carbohydrates like rice, pasta, bread. 1/3 should be protein or vegetables, and then one third should be protein, fat, and dairy products. So you're actually mixing everything. Don't So normally what our plate look like is you've got a pile of, like a pyramid of rice and few chicken pieces or lamb pieces on it. You need to reduce that to maybe a small bowl of rice maximum, and replace other things with salad and or salad or any fruits that might not give you so much calories. What to avoid: pakoras, samosas. I don't want to take this away from you, but you can have it now and again, but not on regular basis, because it's unhealthy. It's gonna cause more heartburn and problems with your body. So try and avoid things like which are fried. You can have baked things or grilled things, which are better rather than fried. Same as with sugar. So we are very fond of jalebis, gulab jamun. All these are very high in sugar. So high sugar is risk for diabetes in our community anyway. So we should avoid all these and try to focus more on milk-based sweets if we were having, and in small quantities. Avoid fizzy drinks altogether in Ramadan, because they've got acid, and acid makes only more acid. So things like rice, pasta, couscous, chickpeas, these are good, supplements to change from your normal unhealthy behaviors. And they are good to consume in the suhoor or sehri time, uh, because they're going to give you energy through the day, because they are slow release glucose. And try to have more fruits, vegetables as well along with it. Avoid parathas and heavy things in the morning, because they're just going to make your tummy upset and give you heartburn and indigestion problem through the day. So there are some meals I don't have time, but just kind of having more cereal, milk base, or things along with your main meal in suhoor is probably good, because cereals will avoid constipation. They will also help you to have that energy released through the day slowly. If you've got diabetes, every diabetes is different. If I was giving this talk 20 years ago, I would have given very easy answer. Now there are 10 medications for diabetes. Every person is on a different medication. So make sure, if you've got diabetes and you want to fast, consult your doctor. If you've got type 1 diabetes, which is of young, and they use insulin only, avoid. You should not fast, because you will put yourself at more harm than any good. If you're type 2 diabetes on tablets, in most cases it's okay to fast, but get some advice. As a general rule, because your day is changed, so whatever you're eating in the day is now nighttime, so change your medications to nighttime, so you're just alternating it, so it works. Sometimes you have to reduce the doses of certain medications, like those ones which cause hypoglycemia or low sugars in your body. So insulin, you might have to reduce the dose, or glycoside, if you're on it, you need to reduce the dose. But consult your doctor or the nurse, because you need medication adjustment, because you don't want to end up in A&E in Ramadan, because you'll be unwell, you'll miss rest of the fast. So do it safely. Checking blood sugar doesn't break your fast, so it's okay to check your blood sugar through the day multiple times. So making sure you don't have low sugars. If you're on insulin, you can get a sensor from your GP, and that sensor continuously monitors your blood sugar, and it helps you. It also alarms as well, but you can only get it if you're on insulin. If you can't do it, don't do it. Simple rule. Because there's an exemption, and Mufti Sahab will talk about those exemption as well. Avoid any exercise, strenuous exercise through the Ramadan, because that will also drop your blood sugars. If you've got asthma, inhalers can break your fast. So use the inhalers morning and evening when you're doing your suhoor and aftar. If you use the inhalers regularly, then your asthma should be under control. But if in the day, if you feel wheezy, you may have to use your emergency blue inhaler, which you have to carry all the time. And then make sure, if you're feeling wheezy, break your fast and do it later on, so that you don't harm your life. There are other medical illnesses. If you've got chronic kidney disease, we advise you not to fast because it's harsh on your kidneys and you may get dehydrated, admitted to hospital. If you've got blood pressure, your medications may need to be adjusted, so speak to your doctor. If you've got heart failure, don't fast because it's not advisable. If you've got heart disease, like if you've had a heart attack in the past, then if it's stable, then you can fast, no problem. If it's unstable, giving you symptoms like chest pains, breathing problems, don't fast, speak to your doctor. And if you're on multiple medications, make sure you speak to your doctor before starting fasting because some of the medications may interact or may cause harm when you're fasting. I think that's all. So
الله لا إله إلا هو له الأسماء الحسنى